The FDA advisory panel is set to meet Friday regarding booster shots. However, top FDA and World Health officials say boosters are not needed for the general population right now, and more evidence is needed to justify them, they say. But what if you've already gotten a booster shot? Dr. Kumar joins us this morning to discuss some of the confusion surrounding these booster shots. Good morning, Dr. Kumar. Thanks for joining us.
Good morning, Leslie. Good to see you. There certainly is some confusion.
Yes, absolutely. Even just this morning, I saw a friend on Facebook. She said she went to go get a booster shot. So what do we really know about these booster shots, and what if you've already gotten one?
Yeah, so let's just go back and visit the timeline of these booster shots, and then I might explain things a little bit better. And so first thing we did was there was approval for the booster shots in immunocompromised people that are on chemotherapy, that are on medications that suppress your immune system, because there was enough evidence that their immunity might wane because they're on immunosuppressive drugs or immunosuppressant. That initial vaccine didn't boost their antibodies enough, so giving them a little extra jolt might protect them against getting COVID. And then we heard that the administration was going to advocate for booster shots for all Americans after 8 months, which would roughly be about September for the earliest people that got the vaccine. And then the World Health Organization weighed in and said, we'd like a moratorium on booster shots. We need to have access to vaccines to the people that have never received them, most likely in other parts of the world and underserved areas. And that would protect us and everybody from getting variants. And then the Pfizer has applied for booster shots to be given for everybody, or at least approved by the FDA with safety and efficacy. And then, just as you've talked about, the recent article in The Lancet, in which two FDA regulators, the World Health Organization, they all combine and say, we shouldn't do booster shots, that the current mRNA vaccines, the Pfizer and the Moderna, are really effective at preventing the worst outcomes of the disease, which is hospitalization and death. And really, here's the critical phrase I hear, is that even if some gain can be had from boosting, it will not outweigh the benefits of providing initial protection to the unvaccinated. And I think that's why we're hearing this news. They want to save the vaccines for the people that haven't received them yet.
Right. And so that was my question. So bottom line, it sounds like there's nothing necessarily inherently wrong with getting a booster shot. You won't get hurt. It's just more so saving them for people who may not have gotten vaccines yet.
That's the way I interpret this, because if the immunocompromised can be advised to get a booster and we're not too worried about the risks in them, I'm pretty confident that the risks in people that have already had 2 shots that are not immunocompromised is quite safe as well. So those people that have had boosters, I don't think you're going to come to any harm, and I don't think there's any added risk. And I think that with Pfizer and the FDA, when they look at that data, we're going to show that it's probably safe and effective. I think that there is an agenda, which I can understand, that the way to protect all of us ultimately is to end the pandemic. Right. And the way to end the pandemic is to get everybody vaccinated in the world that you can, because the Delta variant came from out of this country. The next variant would probably come from someplace out of this country, and we can't stop the flow of people across the world. That we're proving very not good at that. It's very tough to just prevent movement of the virus, because the virus moves with people. And so it makes sense that we ought to prioritize getting vaccines to other countries and ending the pandemic. But I also think that there will be a personal benefit and a role for boosters. I'm saying that without looking at the data, let me qualify that, but because it's already been recommended for immunocompromised people and the risk seems to be pretty low, I think there'll be a personal benefit, but the benefit for all is to end the pandemic.
Right. Real quick, Dr. Kumar, before we let you go, if someone is concerned, is the best advice to talk to your doctor to see if you potentially need the booster shot?
Absolutely right. As always, talk to your physician. I get phone calls every day. I get portal messages from our patients, and we're happy to offer advice without requiring an office visit. Yes, please, if you have any concerns, give your doctor a call.
Okay, very good. We'll leave it right there. Thank you so much, Dr. Kumar. If you have a question for Dr. Kumar, you can always email us at askdrkumar@gmail.com. Also, check out his website, drkumar.com. Thank you so much. Good to see you.